Thank you for choosing to volunteer at the Down Syndrome Association of Greater Cincinnati. We'd like to take the next few minutes to teach or remind you about Down syndrome and the best ways to interact with the individuals and families that we serve. Down syndrome occurs when an individual has a full or partial extra copy of chromosome 21. This additional genetic material alters the course of development and causes the characteristics associated with Down syndrome. Down syndrome is the most commonly occurring chromosomal condition. Approximately 1 in every 700 babies in the United States is born with Down syndrome. People with Down syndrome have an increased risk for certain medical conditions, such as congenital heart defects, respiratory and hearing problems, Alzheimer's disease, childhood leukemia, and thyroid conditions. Many of these conditions are now treatable, so most people with Down syndrome lead healthy lives. A few of the common physical traits of Down syndrome are low muscle tone, small stature, an upward slant to the eyes, and a single deep crease across the center of the palm. Every person with Down syndrome is unique and may possess these characteristics to different degrees or not at all. Life expectancy for people with Down syndrome has increased dramatically in recent decades, from 25 years old in 1983 to 60 years old today. People with Down syndrome attend work, school, participate in decisions that affect them, have meaningful relationships, vote, and contribute to society in many wonderful ways. All people with Down syndrome experience cognitive delays, but the effect is usually mild to moderate and is not indicative of the many strengths and talents that each individual possesses. Quality educational programs, a stimulating home environment, good health care, and positive support from family, friends, and the community enable people with Down syndrome to lead fulfilling and productive lives. We request that you use person-first language when referring to Down syndrome and people who have Down syndrome. Instead of a Down syndrome child, it should be a child with Down syndrome. Also avoid saying Down's child or he has Downs. Down syndrome is a condition or a syndrome, not a disease. People have Down syndrome. They do not suffer from it and are not afflicted by it. We strongly condemn the use of the R word. Using this word is hurtful and suggests that people with disabilities are not competent. As a volunteer, you are here to guide individuals with Down syndrome to success. They are here to accomplish a goal, whether that is a new skill, interacting in a social setting, or learning about a different topic. Here are some tips to help individuals with Down syndrome succeed. Engagement is important in initiating a good relationship. We encourage you to make the first step in introducing yourself and starting a conversation with participants. This could be their first class or event, and we want everyone to feel included. It is a common myth that people with Down syndrome are always happy. Just like everyone else, they have feelings and can sometimes become frustrated, upset, or angry. This may be because they have a hard time communicating, can't accomplish a task quickly, or feel overwhelmed with the stimuli around them. Be patient and understanding. We will assist with any outstanding behavior issues. It is important to remember that you do not have to do everything for individuals with Down syndrome. You want to allow for independence while encouraging results and participation. Consistent reminders about the end goal are helpful in accomplishing a task. There are many ways that people with Down syndrome communicate. At times, you may find that someone is nonverbal and might use a talking device, sign language, motions, or sounds to express themselves. If you are having a hard time understanding someone, that is okay. You can ask the individual to repeat themselves, or you can ask them to point or motion what they need or want. If you are having a lot of trouble, you can always let the person in charge know. Make sure you let others know what you are and are not comfortable with. This includes hugging, personal space, giving out phone numbers, accepting social media requests, and more. Please let the person in charge know if you need assistance in this area. While you are volunteering, please remain professional. Smile, be prompt, be courteous, and avoid using your cell phone, socializing with friends, or isolating yourself from the group. We are so glad that you are here, and we want you to be fully present during your volunteer experience. If you'd like to take a photo, please wait until the end of the class or event, and if it is okay with our participants, the person in charge will let you know who has a photo release signed. Once again, we thank you for your time. The mission of the Down Syndrome Association of Greater Cincinnati is to empower individuals, educate families, enhance communities, and together celebrate the extraordinary lives of people with Down syndrome. We are able to accomplish these goals because of people like you.